This conference will now be recorded.
Okay. Today I will be discussing about a very interesting topic and very important topic in immunology. The reason first I have kept this book is this is one of the best books available in the world about immunology. Those people who would like to just listen to my lecture and make some notes and answer your question in the examination, you don't have to worry so much about the books. But however, those people who wants to read more about immunology, this book by Reut is the best book available in the world. And it is not like a textbook, it is like a novel when you read this book, because you will start thinking yourself in the womb of your mother. And if you have a twin brother by any chance, you will feel all the more wonderful reading this book, how the twins share various antigens and how they identify each other even before they are born. And how the mother identifies the baby when the baby is within the womb is also very interesting phenomena. How the tolerance develops between mother and child and between the twin brothers, all those things are explained at molecular level. And that is why I feel this book is a wonderful book to read, not if not for the exams, at least for the knowledge itself. The other books which I have taken help is Robbins, I assume, and I think my presumption is that most of you are following Robbins, if I'm correct. Otherwise, just open the chapter of immunology in Robbins and have a look before you prepare for your final exam. The other help which I have taken online is videos from Osmosis. I suggest you can have a look at all these three to get more information about the topic which I am going to discuss today. And this is hypersensitivity reactions. For those people who are not very much interested to know about the complicated issues like immunology and read and prepare, I will give you a brief introduction of hypersensitivity reactions. And I'm sure most of you will be able to answer something in your final examination and get at least minimum marks if the question is a short notes or ultra short. Most of the time, hypersensitivity reaction questions come as short or ultra short. The question may be about the classification of hypersensitivity reactions, or one particular type of hypersensitivity reaction may come as a question. And I'm sure if you listen to the first few minutes, you will be able to gather some information. What are the various types of hypersensitivity reactions? How do we classify them? In Robbins, it is clearly mentioned, Coombs and Gell are the people who propose this classification. And I'm saying very easy because it is just 1, 2, 3, 4. 4 types of reactions. If you write that hypersensitivity reactions are 4 and 1, 2, 3, 4, if you mention, you will get minimum marks for your ultra short question. If it is a short notes question, probably if you add little more, the type 1 is an immediate hypersensitivity reaction, type 2 is antibody mediated, type 3 is immune complex mediated, and type 4 is cell mediated and delayed type of hypersensitivity reaction. You will definitely get reasonably good marks for this question in your examination. Well, if you want to extend little more and learn little bit about this type 1, I will give you an example with which you will be able to recollect the information regarding type 1 hypersensitivity reaction, that is allergy, anaphylaxis, anaphylactic shock. And this is mediated by IgE type of antibody. And the main mechanism by which this type 1 hypersensitivity developed is by mast cell degranulation. And type 2 is antibody-mediated hemolytic anemia that is seen in RH incompatibility. I'm sure most of you must have read about RH sensitivity because of RH positive baby in the womb of a RH negative mother and erythroblastosis fetalis in your physiology itself. So just recollect that, and that is type 2 variety of hypersensitivity reaction. And in type 3, it is antigen antibody complexes. These are immune complexes. Once there is an immune complex, the complex name itself suggests that it is a large particle. It cannot be filtered through thin blood vessels. So these immune complexes cause disease like systemic lupus erythematosus, SLE in short, that is type 3 hypersensitivity reaction. If you can write this much for all type 1, 2, 3 and say these 3 are antibody mediated, you will get more than adequate marks for your examination. Well, type 4 is nothing but a cell-mediated immunity. What happens in the formation of tuberculous granuloma is type 4 hypersensitivity reaction. This is for those people, in brief, to know the basic reactions in hypersensitivity. For those people who wants to learn more, can you go to the next slide? My phone says. For those people, can you go to the next slide? Thank you. For those people who wants to know in detail about the immune system and these hypersensitivity reactions, the immune system is meant for protection of the human body. That is what it does in most of us. But if there is no reaction, the individual will suffer from immune deficiency. And suppose if the immune system starts against one own self, then it is called autoimmune. And the next variety is overaction of this immune system, that is hyperreaction. That is nothing but the hypersensitivity reactions, which I am going to discuss in detail for those people who are interested to know more about this and learn a lesson of their life. I know most of you are going to become doctors once you complete your MBBS and become specialists and super specialists and pursue your profession in the rest of your life. As a clinician, you may have to give tablets or injections with the help of somebody else, or sometimes you may have to give injection yourself. And nothing happens most of the time, but suddenly one patient may collapse. And when you check the blood pressure, you will not be able to record the blood pressure. The pulse will be very feeble and the patient will have difficulty in breathing. So you know that you are losing the patient. At that time, if you want to consult another professor, another senior, or your friends, or you want to refer to a book, or you want to Google, even Google sometimes won't help because the internet may not be working. So this is a situation where you have to recollect this particular class and hypersensitivity reactions. And if you can recollect and recall the information, what you're going to listen next few minutes, probably it will save you from regretting for what is likely to happen if you cannot recollect. Because this is called anaphylactic shock, and you may lose a patient. No doctor in this world is willing to lose a patient. Am I correct? I think you all agree with me that you want your patients to be safe. So in order to act quickly, you need to recollect and identify this anaphylactic reaction. And this can be treatable. You can treat a patient who develops anaphylactic reaction, provided if you act quickly and save the life. And it will be a relief for you and no regrets in your life. So what does happen in this anaphylactic reaction? If you see the clinical syndrome, the first one is anaphylaxis. It may be caused by drugs which are given by injection, intramuscular or IV, or it sometimes happens with the bee stings. If it is honeybee comb, which you have disturbed by chance, many honeybees will come and stick their venomous stings into your body, and such a person may develop this anaphylactic reaction. And it can be easily identified by fall in the blood pressure. That is because of the vascular dilatation, and they may develop airway obstruction due to laryngeal edema. And if you don't treat them in time, you will lose the patient. The other types of this immediate hypersensitivity is bronchial asthma, that is airway obstruction caused by bronchial smooth muscle hyperactivity and contraction, thereby narrowing the airways. And inflammation and tissue injury also will add to that, and patients will not be able to breathe and they start coughing. Allergic rhinitis and sinusitis are other things which all of you may see almost every day in your life. But that is a milder form and it can be treated very easily. I will be coming to that a little later. Food allergies. I'm sure all of you are during this lockdown having good food at home, eating nice non-vegetarian dishes like seafood. Seafood sometimes may become allergic to certain individuals with increased peristalsis due to contraction of the intestinal muscles. So you have to be very, very careful. And food allergies are sometimes be fatal because the allergen that is consumed is in large quantity. Do you identify this place? This is ashram, our college. We are waiting for all of you to come back to college and bring happiness and laughter to the campus. It is wonderful this time. It is like Chirapunji, raining continuously and drizzling. Beautiful atmosphere. Only thing is we are missing you all. I'm sure when you come back, I don't know when, but when you come back on a weekend, I'm sure many of you would love to go out and walk around the plants, our cricket ground, and in the garden, and in the cafeteria, and all those places. So most of you, when you go out, some of you may start sneezing when you are near the plants. That could be because of pollen that comes out of the flowers, and the reaction, what you develop is type 1 hypersensitivity. That is mediated by IgE, and it is an immediate reaction as you walk into the garden. As the pollen is exposed or the dust is exposed, the person will start sneezing, itching in the nose, itching in the eyes, then they will start rubbing, adding to more of this inflammation. And you know what medicine you have to take? I'm sure most of you know. We'll come to it a little later. But what happens in our body, we should know. This antigen, this allergen is being taken up by dendritic cells, macrophages, and immediately they rush to their main office, that is the lymph nodes. In the lymph nodes, we have the heroes sitting there. There are T helper cells and B lymphocytes and all those things. The T lymphocyte is one of the powerful cell, but it is very innocent because it has never seen a pollen granule. So this pollen granule, which is carried by this macrophage, presents this antigen to the T helper cell. But again, this innocent cell will not be able to identify the pollen. It has to receive a lecture from the macrophage in the form of co-stimulator. So both these two make the innocent lymphocyte to a primed lymphocyte. Now the lymphocyte knows what is this pollen and it knows its duties. Immediately, because it is a helper cell, it wants to help the body. It will secrete the interleukins. Then there's a whole lot of things that happen. Don't get confused with this big picture, but I want to tell you that not everybody will develop allergic reactions. Only some of them will develop allergic reactions because they have special kind of T helper cells because of their genetic predisposition. So these allergies run in families. This picture may look a little complicated, but I want to tell you that is antigen presenting cell macrophage primes the T lymphocyte and alerts the T lymphocyte to secrete interleukins 4, 5, and 10. And interleukin 4 is the one which is responsible for stimulating the B cell, because B cell is the one which secretes the antibodies. I'm sure you know there are 5 types of antibodies: IgE, IgA, IgD, IgM, and IgG. Of the all antibodies, in type 1 hypersensitivity, it is IgE type of specific to the antigen, whether it's a ragweed or a pollen or a dust particle. So these IgE antibodies will be given to a cell which is located in the mucous membrane, that is the mast cell. It is because it is in the mucous membrane of the nose, bronchioles, and trachea, and also along the intestine mucous membrane, the mast cells are located. And they are equipped with this IgE antibody on them. And the moment the allergen enters into the body, second time, because they are already primed, they are already sensitized, these mast cells will become active and start degranulation. So what do they secrete out? They secrete pro-inflammatory mediators. And these pro-inflammatory mediators are responsible for allergic reaction that we see in hypersensitivity. And that is how rhinitis occurs as you are walking through the garden itself. And this is the immediate reaction. But the type 1 hypersensitivity won't stop with the immediate reaction. There is another component, slow reaction also. I'll come to it a little later. So what happens in this early phase, why there is increased secretion in the nose, why there is itching, I'm going to explain this early phase reaction. The most important pro-inflammatory mediator is histamine. Histamine causes vasodilatation and so there is increased flow of blood, and because of the dilatation, the gap between the endothelial cells widen and the fluid will exude out into the surrounding tissue. Once there is increased fluid in the extracellular compartment in the interstitium, they compress upon the nerve endings which are present in our nose, eyes, conjunctiva, and all that. So once the nerves are compressed because of this edema, itching will start. And then you know what we will do. We will be rubbing our eyes, pulling our nose, trying to stop sneezing, but nothing gets controlled until all these degranulated mast cells will end their duty. And this histamine has got another activity on bronchi, the smooth muscle contraction, thereby leading to difficulty in breathing. This is the early phase. What happens in the late phase? Let us see. These pro-inflammatory mediators release proteases and they recruit more number of T helper cells. They give the duty to other T cells so that more cells come into action. They stimulate in turn eosinophils and basophils. You have interleukin 4, 5, and 10, leukotrienes. All these combined together will add to the inflammation, and that is how late phase reaction occurs. And this will last from 8 to 12 hours. This is for comparison of activation of mast cell, release of mediators. This just to revise again. The mediators will lead to vasoactive amines and lipid mediators like histamine causing immediate hypersensitivity reaction, which happens minutes after repeat exposure to the allergen. Here it is pollen in our ashram gardens. And then the cytokines released from the mediators will lead to late phase reaction, which may last from 2 to 24 hours after the second exposure to the allergen. This graph is very important. When you become clinicians, you should know this. The immediate reaction will start within minutes and may last for a short while. So there is a peak and then comes down. Then the late phase reaction will start. So temporarily for a while, between the immediate reaction and the late phase reaction, you have a dip. And that is a time when the patient may feel all right, and you feel if you will get a false sense that the patient is recovering. But once the late phase reaction starts, it is very difficult to stop. I think this kind of experience, what we are seeing in this COVID-19 time, many patients recover partially, go back home, again get admitted with a late reaction, and then they die. So we have to be very, very careful as clinicians. Again, to sum up the type 1 hypersensitivity, you can have mild symptoms like eczema, allergy, asthma, or it may be very severe symptoms when the allergen load is large, like you consume seafood like crabs or prawns, large quantities, and expose yourself to a honeybee comb where you get multiple honeybees stinging you at a time, injecting their allergen into your body in a large quantity. And also the route of entry of this allergen is also very, very important. Intramuscular, intravascular, and intestinal cause failure of the vital organs with the obstruction of the airway and vasodilatation leading to shock, and it may lead to fatality, and that is known as anaphylactic shock. So this is the one condition which you must remember rest of your life if you want to practice medicine and be quick in your taking decision. Usually, pathologists won't suggest any treatment, but here I thought I will extend a little bit of this information about the treatment. Many lay people also know when we have allergy to take antihistaminics. Yes, it is true, because we have to neutralize the histamine that is being released from the mast cells, which may give immediate relief. This everybody practices, there's no problem about it. But if it's an anaphylactic reaction where the allergen is entering into the body in large quantities and causing vasodilatation and shock, vasogenic shock, then the patient may require corticosteroids, epinephrine, but these should be given under perfect medical directions. And nowadays, the hypersensitivity is becoming such a major issue. There are many experiments that are being carried and many types of treatments like desensitization of individuals who are developing these allergies to the allergens. Many researches are going on, and let us see what comes up. Well, the moment you saw this picture, you can recollect your physiology days where you have studied that Rh negative mother, if she carries a Rh positive baby, she can be fine and the baby will be fine for the first time. But as the first baby of Rh positive is delivered from a Rh negative mother, there's a chance that it is Rh positive RBCs with Rh antigen on the surface of the RBCs will enter into the Rh negative mother, and mother's immune system will consider this as a foreign content, foreign antigen, and develop antibodies. And these antibodies are IgG and IgM. And IgM antibodies, because they are large, they may not be able to enter into the placenta when the mother becomes pregnant second time. But the IgG antibodies pass very freely into the baby, and depending upon the concentration of these IgG levels, if it is less, the baby will be born alive but with hemolytic anemia. If the IgG dose in the mother is very large, then the baby may die within the utero, and when the baby is delivered, it is a huge baby with marked tissue edema and all that, and that is what we know as erythroblastosis fetalis. If you could recollect this erythroblastosis fetalis and Rh sensitivity, that means you know all about type 2 hypersensitivity reaction. This is a diagrammatic picture where you can see a RBC, where you can see an RBC. I'm not able to see the point. Yeah. Here is the RBC, and this is the Rh antigen, and this is the antibody from mother, which is stuck to the RBC and then destroy the RBC. Why it is happening? This is normally whenever there is an infection from the bacteria, the IgG antibody from the individual will also attach itself to the antigen on the surface of the agent and then destroy. This is the way how we overcome infections normally. The same mechanism plays here, and instead of destroying a foreign structure, it will destroy the RBCs of the baby. Okay, so this is called cytotoxic type of hypersensitivity reaction, and here the complement will get activated. I am sure you know a little bit about the complement C1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and all these complements will get activated. And not only that, once the complement is activated, the cell destruction will start because of various enzymes secreted by neutrophil, peroxidase, myeloperoxidase, proteinase, and these will release free oxygen radicals, and which will be responsible for the destruction of the RBC. The same cytotoxic hypersensitivity can destroy a specific organ or a tissue or system as a whole. So in this picture also, it is cytotoxic hypersensitivity destroying the organism. There is another type of cytotoxic mechanism where it is mediated through NK cell, natural killer cell. This natural killer cell plays an important role in cytotoxicity of destroying the RBCs. These natural killer cells are capable of secreting substances called perforins, which cause perforation of the RBC, and then granzymes and granulysins, which will cause apoptosis. They stimulate apoptosis in the cells and death of the cells without causing inflammation in the surroundings. So there are two types of mechanisms in this hypersensitivity. One is cytotoxic, other one is antibody dependent cell mediated cytotoxicity, which is in short known as ADCC. Well, what is it you are seeing? There is a patch, dark patch, which is taking the shape of a butterfly with on the nose, on either cheeks. This is a typical picture of the face of a patient who is suffering from a disease called systemic lupus erythematosus. It is a kind of hypersensitivity reaction type 3 and also type 2. And this disease is a kind of autoimmunity where the cells, plasma cells, manufacture antibodies against its own self, and it is mediated through immune complexes. Normal cells, when they are intact with their nucleus intact and the DNA inside the nucleus intact, nothing happens. When there is a damage to the cells and the DNA comes out, nucleus comes out, then that is identified by these lymphocytes as a foreign. So it will stimulate the plasma cells to make antibodies against the nuclei, which are known as antinuclear antibodies, against DNA, anti-DNA antibodies, single-stranded DNA, double-stranded DNA. So there are various types of multiple antibodies created against one's own self. And these antibodies may be IgM or IgG type. Here you have to distinguish between type 2 and type 3. Both the reactions, it is antigen antibody, but in type 2, the antigen is fixed onto the RBC, whereas in type 3, the antigen is soluble and antibody comes and sticks to antigen, and both of them will be roaming around in the blood. So free floating immune complexes are there in type 3 hypersensitivity. Once it is a complex, it is a larger molecule, and wherever blood vessels are thin, like in the glomerulus of kidney, where the blood is being filtered, the blood goes freely, the plasma fluid goes freely, electrolytes go freely, but not the immune complexes. So they get deposited on the blood vessel wall, on the basement membrane, and because they are stuck, there is something happening, the neutrophils will come and start the activity. They activate the complement. These neutrophils are not capable of destroying these immune complexes. So this is an unsuccessful phagocytosis. So instead of phagocytosing these immune complexes, the neutrophils will start degranulation. So the lysosomal contents, the enzymes, will enter into the based onto the basement membrane, and there is vasculitis, and this repeated vasculitis will lead to thickening of the basement membrane, thereby damage of the glomeruli, thereby fibrosis of the glomeruli, and ultimately failure of the kidney. It is not only in the kidney that it happens wherever you have blood vessels. Can you just guess what are the tissues where you have blood vessels in our body? Almost all the tissues, except perhaps the hair and the nails. So in systemic lupus erythematosus, the reactions what we see start from brain, heart, lungs, liver, kidney, and joints everywhere. So if you can remember the pathogenesis of disease in SLE, you will be able to write type 3 hypersensitivity. Again, one point of difference between type 2 and type 3 hypersensitivity. In type 2, the complement that is used in the reactions is very small quantity. Whereas in type 3 hypersensitivity, the complement used is large amounts. And most importantly, it is C3 and C4, which is being used in type 3 hypersensitivity. I think it is easy for you to remember type 3 and complement 3, isn't it? So it is a large amount of complement, which is also responsible for vasculitis in SLE. Well, and with the rains, we have got snakes visiting our campus. So be careful when you come back. You have to be cautious. And what snake is this? Can you identify? Cobra. This is a cobra. Okay. The reason why I'm trying to show you this is to make sure that all of you listen carefully in between. Make sure that all of you are alert. At least when you see a cobra, I'm sure you will become alert. And there is one disease which is associated with cobra snake venom. Okay, so when this cobra bites someone, What is the thing we do? We will take the patient immediately to a hospital where anti-snake venom is being given to the patient. It is a passive kind of immunization where this anti-snake venom will neutralize the snake venom. Depending upon the dose of the venom that is injected to a person, into a person, the anti-snake venom is given. 1 vial, 2 vials, sometimes it may be up to 8 vials of anti-snake venom also is given to patients in order to save their life. Well, if it is the first bite, he will survive. But if there are some people who are fond of playing with dangerous things, even with the snakes, those are the people who need to know about the serum sickness. This anti-snake venom is prepared from horses and other animals, pigs. So that particular protein from the other animals, other species, is considered as an antigen in the human by the human immune system, and there will be anti-venom antibodies formed against the anti-snake venom that is given to save the life of the patient when he is bitten by a snake. If the same person receives another snake bite and comes back for anti-snake venom, this time he is likely to get relief from the snake bite, but not from the serum sickness, which will develop because whatever serum you have given, it is considered as an antigen, and the antibodies formed in him, which are anti-venom antibodies, will form immune complexes and cause serum sickness, which is very, very severe. Here is very familiar picture. I'm trying to take you from a familiar place to a difficult topic. Tuberculous lymphadenitis. Many of you must have seen the histopathology. Caseous necrosis surrounded by epithelioid cells, which are foamy cytoplasm, slipper-like nucleus, and then you have plenty of lymphocytes in the periphery, and you have multinucleated giant cell. I know epithelioid cell is the pathognomonic cell in tuberculous granuloma, but for undergraduates, giant cell is the one which is favorite because it can be identified very easily. But remember that pathognomonic cell in tuberculous lesion is epithelioid cell. Epithelioid cell is nothing but a macrophage. When it swallows tuberculous bacilli, it cannot destroy within its cytoplasm because it is in the phagosome. The bacteria is in phagosome, and the phagolysosome combination will not occur because these tubercle bacilli have something very powerful in their coat, mycolic acid, which prevents phagolysosome fusion. So these macrophages will try, because they are not able to fight with the bacteria, they unite and join together to form giant cells. So there are two mechanisms that happen in these tuberculous lymphadenitis. One is happening necrosis, the other one is gathering of inflammatory cells. So there are two cells which play important role in type 4 hypersensitivity, which results in tuberculous granuloma formation. So you have two cells, one is helper cell, the other one is killer cell. The helper cell is CD4 and the killer cell is, other name is cytotoxic cell, CD8. Its duty is to kill, destroy, thereby causing necrosis. I think there is multiple choice question, and many of the examiners in the Viva also are interested to know the reason for caseous necrosis in tuberculosis. What cell is responsible? The answer is the killer cell, the cytotoxic T lymphocyte, and its CD number is CD8. I hope you remember this point forever. This CD4 helper T cells secrete cytokines and recruit more number of cells, and how it secretes the cytokines is only after it is primed. So again, macrophage has to bring the tuberculous antigen, give it to the T helper cell and prime it, then only it will secrete these interleukins. And the interleukin 12 is the one which is very important. Here I would like to take your attention to the Montos test, which we do in our hospital also. It is an intradermal test. We inject Mycobacterium tuberculosis protein intradermally and try to see the reaction after 24 hours, 48 hours, and 72 hours. Those people who are exposed to tuberculin antigen, I think most of us are exposed. So I'm sure most of us will show this kind of reaction. There will be reddening initially, and then there will be induration and formation of a granuloma, which results within 72 hours. Most of us, it will subside after, the inflammation will subside after some time, but in some people, it may break and it may form a necrotic area when there is a hypersensitivity reaction. So how does it occur? How does there is induration? The induration is because of the accumulation of these lymphocytes, plasma cells, epithelioid cells, and proliferation of fibroblasts, which will try to limit the area of granuloma and central area of necrosis, and there will be giant cells. This is a reaction what we see in Montro's reaction. Well, the killer cell, what does it do? How does it kill? It has perforin, it has granzymes. So the perforins will perforate the cells and destroy the cells, and granzymes will induce apoptosis. So T helper cells, T killer cells, both of them are responsible for inflammation and tissue damage in type 4 hypersensitivity and resulting in tuberculosis. Well, now we have come to the conclusion of this class with the examples of hypersensitivity reactions, type 1, type 2, type 3, and type 4. The first type 1, 2, 3 are antibody mediated, and type 4 is cell mediated immunity, what we have. And I want all of you to read a little bit today itself so that you will be able to write something if you get this question in your examination. And I have a strong feeling that you are likely to get at least sharp notes or ultra sharp notes on this question. Whether you get it in a question in the examination or not, there is one thing, it is a one-time life lesson, especially when you are tackling the anaphylactic shock in your life later in your future. So here I would like to conclude. You're all welcome to come back and join us. Many of your teachers are in the campus, but the road is quite far and there are so many turnings in the road. I don't know when the right turn will come and you join us back in the campus. So see you soon. Bye-bye. Thank you very much for your kind attention. Can you sit it down? 45 minutes?